Hello and welcome to the Dementia Doctor. Today I have Dr. Parand here to share her amazing research and talk about her work at UCLA. So, Dr. Parand, welcome to the channel. Could you also briefly introduce yourself and tell us about your amazing work?
Thank you. Thank you for having me. I'm an assistant professor at UCLA. I work in the clinic, the memory clinic there, and I'm also part of the Kagan clinical trial program where we do clinical trials to further research in Alzheimer's disease and related disorders.
So, what exactly does your research focus on?
Well, I'm working with a medical student who's also a Harvard Law student. She's a medical student at UCLA and Harvard Law student. She founded this nonprofit group called the Brain Exercise Initiative. They have a website called thebrainexerciseinitiative.com, and you can find information there. She has 80 chapters throughout the United States and also a couple in countries outside the United States, where she pairs students with um, people with memory related disorders and does brain exercises with them for about 20 to 30 minutes one time per week. And she's looking to expand, and she'll be putting together a project to help validate the brain exercises that she's doing currently.
Okay, and so it seems like it's a very interesting program for our seniors where they can do brain exercises with students, and it's virtual, it looks like.
It's virtual, and then she also goes to nursing homes locally too.
Okay.
So, yeah.
So virtually once a week, 20 minutes. And how long can families benefit from this program? Can they do it for a year? Or?
Yeah, they could do it for a long time, but then she wants to put together a research project, and so that could last a brief time period in the research project and having more frequent visits. But right now, it's about once per week.
Once per week?
And then it can be done for as long as the organization is still running.
Yes. And what's the initial response been? Have you talked to any families or seniors who are doing the program?
Oh, yeah, they're very happy about doing it. They like meeting, they like seeing the friendly face that's on the videos and stimulating their brain.
Yes, and as we all know in memory clinics, any ways where we can stimulate the brain, whether it's socialization or mental activity, helps a lot for our brain health. So it looks like you're kind of doing two things at the same time. You're socializing, meeting the same person again and again, longitudinally, and also stimulating the brain in a healthy way, not just, sitting on the computer screen and scrolling, but in actually an interactive way with another human being. Can you tell us more about the benefits for brain health with the social as well as mental stimulation?
Yeah. So right now we know that there's a benefit from keeping your brain active and then engaging in social activities. So it doesn't have to be through this way necessarily. It's one method. There are other ways to still continue and stimulate your brain, but if you're looking for another way, this is a good way, and then hopefully we'll be able to put that in a research study and provide positive information from it.
Absolutely. That's what I tell my families, that it doesn't have to be something that you have to buy on a website. It could be as simple as playing chess or reading a book or gardening or anything you enjoy in your day-to-day life, which is mentally a little bit challenging. And at the same time, you try to be outside or socialize or exercise. So kind of trying to combine the lifestyle measures. This is really, really good work. Is this something that if the families are interested, our viewers are interested, do they need to have a subscription, or how does it work?
No, it's free. And so they're looking to expand to different locations, but you can contact them and then they can pair you with someone. It can be done virtually, so they can pair you with someone who might not be right next door to you or right in the same city, but the potential is there to pair with someone who you can meet with who might be able to do these brain activities.
Okay, then in that case, I mean, it's really accessible to most of our families, and I can share the link to the website, and the families can look up. And if you are interested, you can join in the cognitive program. A lot of times, I think that's one of the most tricky things to tell families about, because for exercise we know it's aerobic exercise, go out for 30 minutes 5 times in a week, and other lifestyle measures we have some kind of ideas like the Mediterranean diet for food. But for cognitive stimulation, I sometimes struggle telling what should the families do to keep the brain mentally active. So this seems like a very perfect solution for that problem.
Yeah. So yeah, it's volunteer, so it's a free service. But if there's any type of donation to support keeping it running to do a clinical trial, they're happy to accept that too. But it's a free service.
Yeah, I
Mhm.
mean, it's a free community service. And of course, we have a lot of money for things that are drugs and medications. But it's very interesting as we have seen the US pointer data and the finger study and how lifestyle changes by themselves can reduce dementia rates by 40%. It's a huge number. And so why not invest in things that are simple and accessible for us in our lives? So this is really, really encouraging and exciting work. Thank you so much for sharing your exciting research with us. Thank you.
Thank you for having me.